I'm going to take precautions based on what you said. However, I will tell you this. You made me very, very tired for a long, long time today. Perhaps you're not quite as resistant as you think, but I'm going to assume you are. And I'm going to give you a walloping dose. Because I'll tell you what, personally, I would never want to wake up in the middle of surgery. I can't think of anything worse. So I'm going to give you a nice hefty dose. And you know, and you know what I would like? Are you her mother?
Yeah.
Yeah, I'm a retired nurse. I'm her administrative assistant.
I would like you to send feedback to me through
Okay.
Dr. Keller.
Sure.
And tell me, I'm interested in knowing if she's really groggy afterwards, because I don't get any feedback on that.
Right.
And then if you want to contact me to find out what I gave for future anesthetics, I'll be happy to tell you.
I appreciate
But
that.
I'm going to go heavy. There are people. There are not many, but there are people who really do wake up during anesthesia. I've only met a couple of them, but perhaps you're one of them.
Yeah, it was scary.
Yeah, and I don't want you to be scared. So I'm going to, what we'll do is we'll give her a blog, give her Versed every, in addition to a full anesthetic, we'll give her some Versed every hour.
It helps also with keeping her in she's not a nervous person. She's not a nervous person, but when you see generalized anxiety, that's acquired from the fact that she's gone through so many traumatic situations. She's woken up numerous times intubated after having seizures. In Atlanta, they're very aggressive about intubating her when she goes into episodes. And Dr. Lagerlin, her neurologist here, and then Dr. Staub, her spells specialist, says, just try your best not to intubate her, because she has on 7/6 was her last seizure episode or spells episode, and they bagged her. They did an ABG. She was stable, and they were able to. They put her in the unit, but she recovered very quickly, and she was fine. But she is. People have said numerous times that what they give her could put an elephant under the table. Her dad could take one Benadryl and he's in a coma for 3 days. But it's just the way it is, and that's the thing that she was mostly concerned about, was making sure that you heard her.
Yeah, I heard you.
Yeah.
And we're going to take that serious, I promise. I do want to tell you this though. You are going to be intubated, and we do have to eventually take the breathing tube out, okay? And you have to wake up before we do it. So you will be awake with the breathing tube in, but you won't be getting an operation while it's happening, okay?
Right.
You understand that?
Right.
We'll take
And
out...
And I'll have medicine that,
Plus, she's
care not to have.
That's exactly
She's
right.
woken up numerous times after having when her sodium dropped, or she had a DVT, and she went into a
How many times
crisis.
has your sodium dropped?
It's about twice, and
Is that from an Addisonian type?
yeah. See, and they didn't. She kept telling them that she had a problem, but they did not
I presume
believe
her
her.
potassium went up at the same time.
Oh yeah, she she actually had an incident, and as I said, I'm a retired nurse, and I woke up at 2 a.m. in the hospital. She actually went into, her blood pressure dropped to 60/40, and the nurse blew it off, even though his tech was saying, we need to call a team. He wouldn't listen. He was a very arrogant nurse. And
where was this?
At Emory University.
Okay.
And he blew it off, and I mean, I did the sternal rub, I did everything, you could drive a nail through her foot, she could not wake up, and finally, he increased her fluids, and he had to get in her face.
Yeah, she was having an Addisonian crisis, it sounds
and
like.
he would not listen. He was so
Well,
arrogant.
I hear you on that one too. What do you take in the way of steroids?
I take hydrocortisone, 10 milligrams in the morning.
Okay.
But if I
Yeah, Dr. Keller said you all had a protocol that sounded like it would work. Just,
Yeah, our protocol will work. Yeah, I mean, we give everybody steroids, but
Yeah.
she needs mineralocorticoids in addition to glucocorticoids. We give Decadron, which is a pure
Yes, right.
glucocorticoid. She needs a mineralocorticoid as well, so we'll probably give her
Yeah.
hydro.
Right.
I have a vial in the room. And just
Okay.
you would need that.
Good for you.
Yes.
Now, I need to ask you the basic anesthesia question, but I appreciate all that information.
Oh, good. And I certainly will give you feedback because I'm all about research and looking at what's gone, in the past and stuff like that. And I really, that's why we brought her here, because we love the fact that you follow the patients on out, years out, and what's going on with them and all. Yeah.